My name is Kouros Emami. I'm a clinical and sports neuropsychologist here at HSS. I specialize in concussion treatment and management. Concussions usually kind of focus around the sports-related injuries and athletes, but we do get a fair amount of non-sports related injuries. So, car accidents, slip and falls. There's many different ways that people can hit their head. I see both types of patients. So my approach to patient care is try to get as individualized as possible. That is trying to get a clear understanding of what the patient's coming in, because no two concussions are the same, even for the same patient. If they have a repeat injury across a few months, they can present completely different. So trying to individualize and tailor that plan for that patient so that we get them on the right course of treatment. And we try to get them back to whatever it is that they love to do, whether it's sports, if it's a non-athlete, whether for work or school. It really comes down to try to get that as detailed plan as we possibly can, so that we can have the best outcomes as possible as well. So my goal is to get patients back to everything that they wanted to do and that they love to do and that they were doing prior to the injury. So whether it is sports, whether it is work, whether it is the weekend recreational basketball player or anything, soccer player, whatever they'd love to do. I highly believe that the best form of treatment is interdisciplinary, multidisciplinary, collaborative approach. Because when it comes to concussion, I lean on many different people to kind of help the patient get better. Physical therapy is probably one of the best tools that we have for treatment. We have vestibular therapists that help us, help the patient get through those symptoms. They get a targeted plan, they get a treatment plan from them that they're supposed to do their exercises every single day. We also lean on mental health professionals, physicians. It's a very nice collaborative approach. And we usually see the best outcomes in those scenarios. Concussion, thankfully, we've learned over time that it is a treatable injury. So it's one of those conditions that patients come in, they don't feel well, but there is light at the end of the tunnel. They will come back out of this. And seeing them, the last visit when they feel 100% fine, the headaches are gone, they're not getting dizzy anymore with exercise. When all of that is resolved and we let them know that, from our standpoint, you're ready to go back, and you see that smile on their face, and they get excited to play in the next game that's coming up. That's kind of why I love what I do.